Arisma and welcome to the Aspiring Medics. If you're new here, we post weekly videos to help you ace your med school applications and we help you get into medical school. So make sure to hit that subscribe button. In today's video, we'll be talking about the Situational Judgement test, which is the last section of the UCAT exam. The Situational Judgement test assesses your capacity to understand real-world problems and then identify critical factors and appropriate behaviors in dealing with them. These questions do not require any prior medical or procedural knowledge. Instead, this section assesses your skills and your behavior, including integrity, adaptability, team involvement, taking into account other people's perspectives, and so on. This section has 66 questions and you need to complete them in 26 minutes. So without further ado, let's get into our top 6 tips for the Situational Judgement test. Our first tip is to read good medical practice and go through NHS values. So the great thing about the Situational Judgement test is that the NHS, GMC and NICE have all laid down exact and specific guidelines on how doctors should act in ethical situations and what kind of ideal behaviors they're looking for in doctors and medical students. So they've laid all of this out in good medical practice, which is something that you can read to understand the theory behind which the Situational Judgement questions are made. You can understand what is expected from you as a medical student and as a doctor and accordingly answer the Situational Judgement questions. So good medical practice is a summary of how doctors should act in ethical situations and what kind of behavior is expected from them, and there's a student version for this as well, which is called Achieving Good Medical Practice. Obviously it is a long read, so read it in chunks, probably make notes on it and really trying to understand what they're trying to get at, what are the key behavioral skills that they're looking for in you, and make sure to keep all of that in mind for the Situational Judgement test, but also for your interviews, because these are the kinds of skills that they'll be assessing you on during your med school interviews. Our second tip is to put yourself in the shoes of the main character. In each question, you take on a different role. You can be an F1, a consultant, a medical student, a patient, or even just a bystander. And each of these different roles in the hospital setting have different duties and responsibilities and will react differently. What's appropriate for one role may be inappropriate for another. For example, breaking bad news is something very appropriate for a consultant to do, but something very, very inappropriate for a medical student to do. So keep in mind what these different roles are within the hospital and what their duties and responsibilities are, and accordingly answer the question. Our third tip is to judge each question within a set individually. Remember, within the same set, multiple questions can have the same answer, so multiple actions can be very appropriate for the same situation. So remember to judge each question independently and individually. For example, if you've made an error, a very appropriate action would be to apologize to the patient. Another very appropriate action would be to rectify that mistake. And you can see that both of these actions are very appropriate and would have the same answer in the exam. Our fourth tip is to know the difference between all the answer choices given to you in the Situational Judgement test. So first, if we go through importance, very important is something that is absolutely essential to consider in this situation. An important factor would be something that's not essential to consider, but something that is useful to consider nevertheless. Something of minor importance is something that's slightly irrelevant, but there's no harm in considering it in your decision making anyway. And something not important is something that is absolutely irrelevant. Now going through the appropriateness questions, something very appropriate will be the most ideal response to the situation. Something appropriate but not ideal is a good solution, but it's not the best. Something inappropriate but not awful is not a good solution, but there aren't that many cons to it. And something very inappropriate is something absolutely terrible and would definitely make the situation worse. So it's really important to know the difference between these answer choices, because it can get very confusing to choose between very important and important, for example. So make sure you know these differences and remember that while you're writing your exam. Our fifth tip is to read the explanations of all the questions that you attempt while preparing for the UCAT exam, whether you get these questions right or wrong. Now you can use this as an additional resource to reading good medical practice, because by reading the explanations, you get an idea of what skills and qualities the UCAT is looking for in the Situational Judgement test. Resilience, empathy, honesty, and so on. And you can make a list of these values and skills and know that these skills are something that's important and something that the exam is looking for, and keep that in mind the next time you're attempting a question. For example, apologizing is seen as a very appropriate action in the situational judgment test of the UCAT exam, and that's something that you may not have realized before attempting the exam. By reading more and more explanations of questions, you would realize this pattern and make a note of this and keep that in mind for all of your future questions. Our sixth and final tip is to revise some key concepts relating to the situational judgment exam. So these are the 4 pillars of medical ethics that you would have heard and learned about hopefully before, but we'll quickly recap them now, and we're also going to put up a graphic of it here. So the 4 pillars of medical ethics are autonomy, which means that patients should have the right to make their own decision and they should be supported in doing so. The second pillar is beneficence, which means that we as healthcare workers should do everything in our power to benefit the patient and ensure maximum happiness and good health for the patient. The third pillar is non-maleficence, which means do no harm, essentially. So the fourth pillar is justice, which means obviously treating all patients equally regardless of their background, but also thinking about the greater good. For example, breaking confidentiality because it would lead to an epidemic. Another key concept to recap are the 7 C's. So that's care, compassion, courage, competence, consistency, commitment, and communication. The 7 C's are an easy way to remember the NHS values, and you can use these while making decisions on your situational judgment test and even during placement. So that brings us to the end of today's video. We hope you found our 6 tips useful, but of course our biggest tip is always to keep practicing and to learn from your mistakes. If you have any questions about the situational judgment section, leave them down in the comment section below and we'll get to it. See you in the next one.